Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Sigmoidoscopy. Introduction. Colon diseases are common. A sigmoidoscopy is a test that can help diagnose colon diseases. If your healthcare provider recommends that you have a sigmoidoscopy, the decision whether or not to have the procedure is yours.
This program explains what is sigmoidoscopy and reviews its benefits and risks.
Anatomy.
The colon is the last section of the intestines, also called the large intestine.
Swallowed food goes through the esophagus, which is the feeding tube. After passing through the esophagus, swallowed food travels to the stomach, where it is digested. Digested food moves from the stomach to the small intestine, where nutrients are further digested and absorbed. After passing through the small intestine, fiber and digested food reach the colon. In the colon, more nutrients get absorbed and stools are formed. Stools are then stored in the end of the colon, called the sigmoid colon and rectum, before being pushed out of the body.
The colon has several parts, which include the following: ascending colon, transverse colon, descending colon. A colonoscopy is a test that allows the doctor to go deep inside the colon to examine if it has any abnormalities. The end of the colon is made of the sigmoid colon, rectum, anus. During sigmoidoscopy, the doctor looks at the end of the colon by inserting a tube with a tiny video camera at the tip of the tube. The tube is called a scope. Because the tube does not go as deep into the colon as in colonoscopy, sigmoidoscopy has a lower risk of perforating the colon. For this reason, doctors recommend sigmoidoscopy over colonoscopy for some patients. Sigmoidoscopy.
The most common colon diseases are colon cancer, diverticulitis, and ulcerative colitis. A sigmoidoscopy can help healthcare providers find colon cancer early. Colon cancer can be cured if it is found before the cancer has a chance to grow and spread. Diverticulitis is a disease that causes small pouches called diverticula to develop in the colon. The pouches can get infected, which leads to serious medical problems. Ulcerative colitis is when the colon becomes inflamed. It can lead to more serious problems, including bloody diarrhea.
A flexible sigmoidoscopy is a simple procedure that helps healthcare providers see inside the end of the colon using a flexible fiber optic scope. In some cases, the doctor may use a rigid scope. The procedure is then called rigid sigmoidoscopy or proctoscopy. Flexible scopes go deeper inside the colon than rigid scopes do.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Before a sigmoidoscopy. Before a sigmoidoscopy, your colon is cleaned out so that your healthcare provider can see problems more easily during the procedure. Several days before a sigmoidoscopy, you will be restricted to a clear liquid diet. This causes very little stool to be formed.
The colon must be cleaned out even more by taking strong laxatives. You may be asked to drink a gallon of a special cleansing solution the night before the sigmoidoscopy to flush out the colon.
You should not eat or drink after midnight on the day before the procedure. It is important to follow the instructions of your healthcare provider in order to have a clean colon. The cleaner the colon, the more likely it is that a sigmoidoscopy will find any potential problems. Rarely, a sigmoidoscopy has to be postponed if your healthcare provider feels that the colon is not clean enough.
Remember to tell your healthcare team about all of your medications. If you are on a blood thinner, Your healthcare team may ask you to temporarily take a different blood thinning medication, which is known as bridge therapy.
Procedure. A sigmoidoscopy is an outpatient procedure, which means you will probably go home the same day. You may need to have somebody drive you home. The procedure usually takes 10 to 15 minutes. A sigmoidoscopy is usually done while you are awake and alert, but if you are anxious or worried about the procedure, you may be sedated for comfort. You will lie on your side. A well-lubricated scope will be gently inserted into your rectum.
Your healthcare provider will look at the inside of your colon by looking at a video screen that the scope is attached to. The scope is inserted all the way up to the sigmoid colon and part of the ascending colon. The scope can blow air into your colon to expand it, allowing a better view of the lining of the colon. The doctor can insert tiny instruments through the scope to take tissue samples. This is known as biopsy. If any abnormal areas are found during a sigmoidoscopy, they may be taken out through the scope.
After your healthcare provider has examined the sigmoid colon, the scope is taken out. If you were sedated, you will be allowed to wake up. Biopsy tissues are sent to a pathologist who reviews them under a microscope to check for cancer, infection, or inflammation. The results of these tests may take a few days to receive. Risks and complications. A sigmoidoscopy is safe. There are several possible risks and complications that are unlikely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. Risks and complications of a sigmoidoscopy include those related to sedation if used, and those related to the procedure itself. Risks related to sedation are unlikely, and most patients tolerate sedation well. Some of the possible risks related to sedation include allergic reactions, nausea, vomiting.
Some risks related to the procedure are rare. They include infections involving the abdomen. Treating these infections may require long-term antibiotics and sometimes surgery. The colon may be injured or perforated. This may require an operation to fix the perforation. Bleeding can happen, either during or after the procedure. It is normal to have some blood come from the rectum after a sigmoidoscopy, especially if a biopsy was done. But if heavy bleeding happens, another sigmoidoscopy and possibly surgery may be needed.
After a sigmoidoscopy.
If a biopsy was done during a sigmoidoscopy, you may have some bleeding. If you have severe bleeding at home, contact your healthcare provider right away or seek immediate medical help. If you become dizzy or weak, or if you develop a fever or abdominal pain, contact your healthcare provider. Mild cramps and bloating are normal. Before you go home, your healthcare provider will tell you what they found and whether they did a biopsy. If a biopsy was done, your doctor is very likely to recommend a colonoscopy to examine the upper parts of the colon.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A sigmoidoscopy is a test that can help diagnose colon diseases. The most common colon diseases are colon cancer, diverticulitis, and ulcerative colitis.
Before a sigmoidoscopy, you will take strong laxatives to clean out your colon so your doctor can see abnormalities better during the procedure. It is important to follow the instructions of your healthcare provider in order to have a clean colon. The cleaner the colon, the easier it is to find any existing problem.
A sigmoidoscopy is usually done while you are awake and alert, but if you are anxious or worried about the procedure, you may be sedated for comfort.
You will lie on your side during the procedure. A well-lubricated scope will be inserted into your rectum. Your healthcare provider will look at the end of your colon by looking at a video screen that the scope is attached to. If any abnormal areas are found during a sigmoidoscopy, they can be taken out through the scope to examine in the lab. If the results are positive, which means abnormal tissue is found, your doctor will advise you what tests to have next. If the results are negative, which means no abnormal tissues were found, the doctor will recommend how long to wait before you have another sigmoidoscopy.
If a biopsy was done during a sigmoidoscopy, you may have some bleeding. If you have severe bleeding, contact your healthcare provider right away. A sigmoidoscopy is safe. There are several possible risks and complications that are unlikely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. Thank you for using Explain.